I think a lot of different companies are studying monoclonal antibodies, either as drugs that target surface proteins and in that fashion, through antibody-directed cytotoxicity, eliminate the malignant cell. There are also attempts to target proteins on the surface of cells that keep them from being eliminated by the body's immune system or macrophages. So, for example, CD47 antibody Magrolimab has shown a lot of promise in combination with azacitidine. CD47 is a "don't eat me" signal that is on myeloid malignant cells. And if you hit it with an antibody and you get rid of that signal, the cells get eaten by macrophages. It appears, at least in relatively limited data, although larger trials are ongoing and constantly being updated, that there is promise when this particular antibody is combined with azacitidine in patients who are newly diagnosed, who have AML and are older and are getting the combination of azacitidine with the drug. And in particular, there may be heightened promise in patients who have p53 mutations, a very, very challenging mutational subset that has basically been resistant to every class of drug, chemotherapy, combination therapy that we've thrown at it. It may be that, albeit right now the data is in a smaller percentage of patients, a smaller number of patients, perhaps as we get more data, we hope that this early promise in the smaller group of patients does translate to the same degree of efficacy in a larger proportion of patients with p53 mutated AML. Folks have also studied antibodies that are inhibit the immune checkpoints, and in that fashion lead to the body's immune system eliminating malignant cells. Those results are still early, and there wasn't much promise with traditional immune checkpoint inhibitors that have been studied to date. But sabatolimab, a TIM3 targeted drug, another immune checkpoint inhibitor, is showing some promise in myeloid malignancy. So we shall see whether there is traditional antibody targeting of myeloid cell surface markers such as CD33 or CD123, or affecting sort of the body's immune system to try and wake up and eliminate malignant cells, is a potentially novel and effective approach going forward.